my name is Jessica and I'm a nurse practitioner student. I'm going to be doing a physical exam on my patient and his name is John. I'm going to start out by palpating his scalp for any deformities or irregularities. Then I'm going to palpate his sinuses for tenderness or pain. I'm going to inspect his temporomandibular joint, if he could open and close. No pops or clicks or abnormalities. Then I'm going to test his cranial nerves. If you could wrinkle your forehead, squeeze your eyes shut, smile, clench your teeth, puff out your cheeks, stick out your tongue. Okay. If you could close your eyes for me and tell me where you feel the sensation.
Forehead, cheek, jaw. Forehead, cheek, jaw.
Okay. That's all intact. Next, I'm going to inspect his eyes. The eyes are symmetrical. The eyelashes and eyelids and palpebral folds are all normal. There's no exudate. The sclera and the conjunctiva are clear. The irises are symmetrical. I'm going to do the cover-uncover test. If you could focus on the wall for me. The test is normal. If you could follow my finger, I'm testing the extraocular eye movements follow my finger without moving your neck. Okay, next I'm going to check your pupils and your reaction to light. The pupils are equal, round, reacted to light, and accommodation. Next, I'm going to check the red reflex in the lenses. Red reflex is present. The lenses are cleared. The disc and cut margins are normal. The retinal surface is normal. There are no lesion or hemorrhages. The red reflex is also present in this eye. The lenses are cleared. The disc and cut margins are normal. The retinal surface is normal. There are no lesions or hemorrhages. The nose is symmetrical. The septum is midline. The turbinates are moist and pink. No drainage noted. The ears are symmetrical. The external canals are free of cerumen and exudate. The tympanic membranes are pearly gray, no inflammation or exudate noted, and freedom of movement. The external canals are free of cerumen or exudate. The tympanic membranes are pearly gray, no inflammation, freedom of movement, no deformities. Next, I'm going to inspect the mouth. You could open the buccal. The lips are symmetrical. The buccal mucosa are normal. The gums are normal. The oropharynx is normal, no exudate. The uvula is intact. The anterior pillars are intact. No swelling of the tonsils. If you could stick your tongue out for me. Say ah. And the gag reflex is intact. There are 28 teeth. The color and surface characteristics are normal. And I'm going to test the movement of the tongue. You can push up. All of that is normal, as well as the floor of the mouth. Next, I'm going to inspect his neck. I'm going to test the range of motion and the strength of resistance. Okay, if you could turn your head this way, turn the other way, do this, and look up, and look down. Okay, if you could push against my hand, push against my hand, push against my hand, hand, and then turn and turn. Okay. The shoulders are symmetrical. You could do a shoulder shrug for me. The trachea is midline. The carotid arteries, I'm going to palpate. +2. I'm going to palpate the lymph nodes. They are pre-auricular, post-auricular, occipital, post-cervical, superficial, chain, tonsils, the submaxillary, the submandible, submental, the deep cervical chain. If you could turn your head. Turn your head. For lumps, no palpation. I haven't felt any supraclavicular or infraclavicular. Next, I'm going to auscultate the carotid arteries for bruits. With the bell of the stethoscope. No bruits noted. As I said before, the trachea is midline and not deviated. There's no goiter present. I'm going to palpate the thyroid gland. If you could swallow for me. Swallow for me. Next, I'm going to no nodules or enlargement in the thyroid. Next, I'm going to palpate and inspect the upper extremities. There's no soreness, no abnormalities in the skin. The fingernails are normal. The capillary refill is less than 2 seconds. No clubbing noted. I'm going to test the range of motion in the shoulders. You could move that and up. Bend your elbows. Move your wrists. Your fists. Okay. Now I'm going to ask you to push against my hands. Okay. Hold your arms like this and pull. Push. Push. Push and pull. Okay. Now I'm going to squeeze your fingers and try to open your fingers. Okay. All of that is intact. I'm going to palpate your brachial arteries. Both are symmetrical, 2+, and symmetrical radial arteries. I'm going to test your deep tendon reflexes. I'm going to test the tricep reflex. If you could close your eyes and think of a place that you would like to visit. Relax. Okay. I'm going to test the brachial reflex and the brachioradialis. I'm going to do the same on this side. You could relax. Okay. The brachial and the brachioradialis. Okay. I'm also going to test the reflex, deep tendon reflexes on the lower extremities. You can scoot back just a little. I'm going to test the patellar, and the ankle, and the Babinski. Okay, those are all normal. Next, I'm going to inspect the patient's back. So if you could come and sit on the edge of the bed for me. So the spine is straight, the shoulders are normal and symmetrical, the scapular area is normal. I am going to percuss to check for consolidation. There's no dullness, percussed, in any of the long fields. I'm going to percuss the costovertebral angle and check for tenderness. No tenderness noted. I'm going to listen to the lung fields. Every time that my stethoscope touches your back, take a deep breath. Sorry. Okay. All the lung sounds are clear. Every time my stethoscope touches your back, say E-E, okay?
E-E, 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 E-E.
Okay, good. Consolidation. Every time my stethoscope touches your back, say the number 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay. Egopony and bronchophony are negative. The AP diameter is normal. There's no barreling of the chest. The respiratory effort is normal. The depth is normal, and the rate is normal. I'm going to test for diaphragmatic excursion. If you could take a deep breath. Excursion is normal. If you could come and sit back here for me. Next, I'm going to inspect the patient's chest. All the skin is normal. I'm going to listen to, and the posture is normal. There's no exaggeration and no tinting. Every time my stethoscope touches your chest, take a deep breath. All lung sounds are clear. I'm going to percuss the lung areas for consolidation. No consolidation or dullness noted. Next, I'm going to listen to the heart sounds with the diaphragm first, with the pulmonic area, second pulmonic, the aortic, and the apical. S1, S2 noted, no murmurs. Next, I'm going to do it again with the bell in the same areas. Pulmonic, second pulmonic, aortic, and apical. No murmurs noted. Next, I'm going to have you lay on your back. Put your head on the pillow. Okay. I'm going to listen to the heart sounds again with the bell or with the diaphragm in the same areas. S1, S2 noted, no extra heart sounds. And no murmurs noted. Then I'm going to inspect the patient's abdomen. I'm going to assess for distension. There's no distension. There's no visible masses. No bounding of the abdomen. I'm going to first auscultate in each quadrant. The Bowel sounds are positive in all 4 quadrants. Next, I'm going to percuss the abdomen. I'm going to check for the size of the spleen. Or the size of the liver. There's no hepatomegaly. I'm going to percuss the rest of the abdomen. No splenomegaly noted. All normal on percussion. Next, I'm going to palpate light, medium, and deep and assess for pain or masses in the abdomen. Then I'm going to assess the kidneys. Those are normal. Next, I'm going to assess range of motion and strength in the lower extremities, starting with the hips. You could lift up, out, and in. You could lift up, out, and in. The knees are normal as well. The ankles are normal. I'm going to test the strength. Can you push against my hand? Push against, push against, push against, push against my hands, pull, push up, and push down. Okay? You can sit up, please, sir. Okay? You can stand right here for me. Face this way. The spine is straight, no curvatures noted as he's standing. You can lean forward and touch your toes. No abnormal curvatures in the spine noted. You can stand, please. Turn this way, sir. If you could walk a few steps this way for me. Gait is normal. You could turn around and walk heel to toe for me. That is normal. Okay. You could feet together, eyes closed, and arms straight out. Romberg test is negative. And that concludes my physical exam. Thank you.